Hello, healthcare providers. This is another episode for our Revenue Rescue series where we are actually educating the healthcare providers to actually build something good for themselves. Most of the students who are just getting out of school, the most of the doctors, the practitioners who are just coming out of the school these months and, they have no idea where to start from, what to do. So we'll be discussing all of the scenarios step by step. I'll try to break down that in a very convenient manner so you guys can understand what exactly you'll be doing, what you'll be needing, and to actually build a successful business in your private practice. And most of you guys will be, serving residency, making sure that you guys know the things that you will be doing in the private practice, and most of the doctors who will be having the plans to go private down the road. But again, there are a lot of doctors, a lot of practitioners out there who just want to start, with their own private practice. And for them, it's kind of a lot of they're out there to adapt and to digest, in the healthcare, because they read in a medical school to treat the patients again, but it's not always about to treat the patient. Many providers spend years preparing for, the care for the patients, but very little time learning how to build a successful practice. And today we will be, walking you through the kind of a roadmap for every new practice should supposed to know before opening their doors. So we'll go with step by step. I'll make sure I will keep it very precise, convenient for everybody so they can understand what exactly I'm saying, because obviously diagnosis has a different language, and again, RCM, revenue cycle, has a different language. So I don't want to complicate the things. I want to keep it very simple, precise. As I say always, that healthcare by itself is very, very complex. We try to making things very convenient for every provider out there so they can understand better, so we can help them out actually. So let's just start with the foundation. So step number one is going to be the foundation. You have to understand that you'll be needing a business registration, the EN number. You can set up your NPI by yourself. It's very convenient, easy. State licensing needs to be there, obviously, you know, and then malpractice insurance. So if you have, if your foundation isn't solid, everything else become harder for you. So you have to work on those. These are initials. Every provider has that. Even if you don't know how to do it, let us know. We'll be happy to help you out with that. Then the second phase is going to be credentialing and contracting. They are two different things. Most of the healthcare providers don't know about it because, people confuse them. Credentialing and contract is same, enrollment same. They are all like they are different. The terminology sounds familiar, sounds, a little bit like similar to other, but again, it's very different. Credentialing means it's kind of just a verification of the documents that you will be doing, or your credentialing specialist will be doing on your behalf. And then the contracting part comes in where, you'll be actually signing the contracts with the insurances, like for example, Blue Cross, Her, Cigna, Humana. You'll be, Magellan, or you will be signing the contracts with them after reviewing everything. Then there's a part of it. You can say CAQH, Medicare enrollment, Medicaid enrollment, commercial plans out there. So these are basically the contracting and credentialing parts of it, where you verify everything. That is credentialing, and contracting, where you actually sign the contract with the payer to get you enrolled with them, to get you started, and now you're affiliated with them. Now you can see those patients. So you cannot collect payments from the insurance companies if you're not properly enrolled or and contracted with these insurances. So that's your kind of a second step you need to, fill out or will be needing help with. Then obviously there's billing and coding. Obviously their coding is initially like first it's coding and then it's billing. Most of the time, what I have so far is people do mistake on this thing. There is no billing without the codes. So coding is very crucial. Coding is there. Most of the provider doesn't know about it. It's totally fine. It's not your job to know these ICD, CPD codes, HCPCS codes out there because that's not you read in a medical school. That's where you'll be needing a professional who can help you out with that. If you know these codes, wonderful. If not, you'll be needing a certified coder on your end, that can actually help you out who can actually help you out in terms of, reading your diagnosis, your progress notes, letting you know what exactly you need to put in the CPD side of it and the ICD side of it to actually get you proper reimbursement. So that is accurate coding, clean claim submissions after, coding and everything, payment posting, whatever they received. Whatever you receive from the insurances, account receivable follow-ups if it's established practice or it's been a while you haven't, got any, you haven't got collected anything and it becomes an AR for you, then obviously you'll be needing an expert who can help you out with that. That requires a little bit, follow-ups, diagnosis, see what exactly is why you're getting the AR and all of that stuff, a little bit analysis on that side. Then obviously someone who can help you with the denial management because you will be getting denials initially, even if you're having someone, a great partner on your behalf, on your side. But again, you can expect these things. It's very common. Denial happens all the time, but the good thing is, and or you can say what doesn't need to happen is because the denial shouldn't be go like it again and again. You won't need to get that a lot of time. So if it's one denial and it's fixed and that's not happening again, it's wonderful. You're with the right partner. Most of the experienced people out there who actually knows your specialties, who know how to dealt with your state and everything. Uh, for those you can not like you can be fine. You won't be getting any denials, but again, that happens. So revenue start with the accurate documentations and ends up on a proper follow-ups. That's kind of in step number three that you need to remember when you're setting up the practice. Then step number four would be, I would say, compliance and auditing because that has its own significance. That department actually plays a vital role when, it's helping your practice. So you can say HIPAA compliance, documentation audits, coding audits, internal reviews, quality reviews, risk management. Those are the things which you'll be needing, or those are the things which you need to look into the kind of the billing company that you will be working with. You need to make sure that they already have those things set up that can help you a lot to actually sustain everything in the right manner. Compliance protects your practice, auditing improves your revenue. So it's wonderful to have that. Step number five is going to be, the technology and workflows, EHR selections, practice management systems, patient scheduling, the workflow, that how you will be seeing those patients. If you will be seeing those patients tomorrow, you need someone to verify their eligibilities or, can say in other words, in a very simple words, you need someone who can actually verify their insurance and let you know what exactly you need to collect in front of, let's just say you're seeing a patient tomorrow, you need to know what exactly you need to collect from them upfront, like that is co-payments, and either their card is active or not. So either they are on your plans or not. So those are things which you'll be needing from your biller or someone who's doing your front desk at that time. Electronic claims and reporting dashboards are very important. So the technology should supposed to simplify your workflows, not complicated it. So that's step number five. Six is going to be very important one because I believe that is marketing and patient growth. You need to have a good website, connect with someone who can actually who have the sense of the industry, who know exactly how the patient will react to your website when they're, you know, reviewing your website. They should supposed to understand what exactly they will be going through, how they will react to the website, what exactly if the website needs to be user friendly for the patients. So find someone right, you know. So they should supposed to have. We created like almost 50 to 60 websites so far for every provider that we work with or somehow we got reference and we know how it works. So find someone who can actually do that for you, and then build your Google business profiles. Online reviews gonna make a huge impact on it, humongous impact on it, and referral relationships, social media. Nowadays, if you're on social, people will recognize you, people will look into you, they will get to you. Even the best, and the community outreach is also, going to be wonderful for you. And even the best providers can help those patients who don't know even this practice exists or not. So you should supposed to be have a wonderful goodwill when it comes to the online presence and everything. Then seven is going to be monitor your numbers. You should supposed to have the KPIs like days in AR, collection rates, denial rates, no-show rates, patient retention, revenue per visit. These are the things which actually, if they are measured, when they get measured, you get the improvement on your practice. And the last, but not the least, I would say the last step will be just to never stop improving. You should supposed to be training your staff. Do not stop that for any reason. Train your staff every month or so, or every, you know, you can say month or two, process improvements, quarterly audits for all those providers, staff, front desk, and everybody. Providers, education needs to be there. So you're just supposed to be make sure that you're reading, you're learning everything day by day, and you're adding your more certifications, more, things into your, academic background and everything. Then patient feedback. So successful practice treats improvement as a continuous process. You should supposed to be doing that if you would like to build a wonderful, I would say kickstart your business and have a wonderful practice down the road. These are the keys that you need to follow. I try to make sure that I can cover all these in one video. So that's why I was going a little bit fast, but you can understand and you can go back even though and see what exactly those steps were. And because I personally think that most of the successful practice don't rely on one department. That's why even though we have these departments and you know they succeed, because every part of the practice works together. Credentialing gets you in the door. Contracting, determines how you get paid. Coding tells your patient story, like what exactly the patient is being treated for, you know, and the billing turns into your work, into revenue. Compliance will protecting your future of the practice, making sure you don't end up in an audit. You know, Marketing will be bringing the patients through your doors, and the continuously improvement will be actually keeping the practice go. So, it will keeps your practice growing. And if you're building a new practice, don't think of these as a separate departments. Think of them as a one connected system. Find some vendor or billing company or consultant who can actually give you these options. A one-shop stop, one area, fails, the entire revenue cycle feels an impact. So this is how you will rescue your revenue before the problem ever begin. So find a right partner who can help you out with that and make sure choose wisely again. And you're just getting out of school, so don't worry about it. You will learning things down the road. You will make mistakes, but don't worry about it. You just have to keep going and make sure that you will get there. If you have any questions, guys, let us know. We'll be happy to help you out with this, and looking forward to make sure that all of those who are just getting out of the medical school who are actually very eager to learn, very enthusiastic, they can actually have a wonderful practice and help their patients and live, the life they want. So I look forward to speaking with you guys in another video. Have a wonderful day ahead and stay blessed. Talk soon.